You're listening to Fast Facts, Ask the Expert with Tom Viola. All right, listeners, you are in for a treat today. Welcome back to Fast Facts, Ask the Expert with Tom Viola. Tom, thank you for being here.
Andrew, thank you so much for having me. I love working with you, buddy.
Yeah, dude, this is always a treat for both of us. I love this. Is like our favorite get-togethers right here. Talking about dentistry, talking about local anesthesia, and I love trying to stump you. So here we go. Here's another one for you. You always hear about, I want to say, the whiny baby patient that's like, I'm always hard to get numb, and I'm like, you know what? Let me just try it. Let me add it. Let me prove to you that you're not actually hard to get numb. And in reality, there have been, several patients where I throw my hands up, I'm done. But I'm sure that there's even more of the patients I didn't come in contact with that's like, they just can't get numb. So are there legit issues with getting someone numb other than just being a poor clinician?
Well, again, it's all about accuracy and technique, buddy, right? And those are things I wish I could teach all the people who attend my courses. But again, it's not my wheelhouse. But yet, those are the things you have to hone your craft, right? Over years and years of practice to get all of that stuff nailed down and get it to the point where, it's almost second nature. But I think we could talk a lot about the actual anesthetic agent you're using. And so when it comes to patients who are difficult to anesthetize, of course, like we said in our last episode, patients with red hair, patients who have an issue with substance abuse in their past, like methamphetamine and cocaine, and patients who are heavy cannabis users, all of those nice folks represent some challenges to us clinically as far as getting them anesthetized. But let's talk for a minute about the mechanics and the chemistry involved in anesthesia. Every cartridge of local anesthesia that we inject contains acid. So the more cartridges you use, the more acid you're injecting into the tissue. Now, you know what that means. It means that by acidifying the tissue, you are making it less likely for the anesthetic agent to work properly, because in order for the anesthetic to work, it has to be in a near neutral, almost a basic environment. We rely on the tissue buffering capacity to buffer out the acid in the cartridge. But I would love to say for everybody listening, hey, for the rest of your life, you're only going to work on patients who are, pristine, healthy tissue. But that's just not the case in dentistry. It's the exact opposite, right? We're always working on some diseased tissue, and those little jerks, as I like to call them, that are in the tissue that are producing acid as a metabolic waste product are already polluting the tissue with acid. And here we are adding even more acid to the situation with every cartridge of anesthesia we use. And that ultimately makes it more difficult for the anesthetic to do its job. And that's why I think anesthesia fails. The good news is there's some easy rules to follow. Okay, you ready, Andrew? Here they are. It's not me to stump Andrew. Ready? The rules of thumb with anesthesia are less is more and more is more. How about that? So if you're like, okay, I'm confused, isn't that contradictory? Let's do it this way. What's better? 4 cartridges of 2% lidocaine or 2 cartridges of 4% articaine? If you're doing the math in your head, you're saying, well, it's the same number of molecules. What's the difference? You're right, except the 2 cartridges of 4% articaine deliver the same number of molecules of anesthesia in less cartridges, therefore less acid. So more is more, right? Meaning higher concentration anesthetic agents deliver better anesthesia, more profound anesthesia, because they're delivering it in less volume and therefore less acid. But less is more too, which means what? Less cartridges is more, right? So always shoot for the more concentrated anesthetic solution that's going to deliver the molecules of anesthesia you need to get the job done in that less volume and that less acid. So either way you look at it, it's the same answer. Of course, again, putting the anesthesia into the tissue, you've got to realize that at some point, you got to know when to fold them, as the great man once said, right? And realize that if you're not getting it done with 2 or 3 cartridges of your favorite anesthetic, it just may not get done that day, because any more than that, and the acid is working against you. So know when to fold them and know when to walk away, right? Say, okay, well, I guess this isn't going to happen today. We've got too much, we're battling here, we're battling infection, we're battling inflammation. And maybe it's time to relent and say, okay, we need 10 days of amoxicillin here and maybe some ibuprofen, and get the tissue back in form where, there is some buffering capacity to the tissue. We've eliminated a lot of those little jerks, as I like to call them, that make acid as a metabolic waste product. And so now the tissue and the patient are more amenable to anesthesia than they would have been when you first tried.
And there's no shame to walking away, right? I mean, it's the good thing to do for the patient. It's the right thing to do for them.
No shame in walking away. Of course, people who run dental practices may not be happy hearing me say that because we don't make any money with people leaving the office untreated. But at the same time, I think it's like you said, it's the right thing to do for the patient, Andrew, because ultimately they may not be happy either, since they're going to look at you and say, well, why can't you get me numb? But I think after the first few times and they realize that, by not getting numb, they're going to be in more pain, they'd gladly walk away if they had to and come back when things are in much better shape.
I would agree. Tom, again, great stuff. Thanks for being here. How can people find you?
They can find me anywhere on social media at Pharmacology Declassified and on my website at tomviola.com.
Great.
Thank you, sir.
Thank you for listening to Fast Facts Ask the Expert. If you have a topic you'd like one of our experts to answer, simply email me, Andrew@ataleoftwohygienist.com, and we will get it on the air as soon as possible. Thanks for listening.